The donated equipment will be used in the management of patients with respiratory infections and with difficulty in breathing. Amid the COVID-19 pandemic, such equipment is vital, especially in the Erongo region state hospitals.
Some of the equipment or some of the resources are actually consumables, things that we are using on a daily basis, and they need to be replaced either daily or weekly. So hence really the need for us to be able to replace or replenish these resources or equipment, as well as personal protective clothes.
We observed that there are still a defined need that needs to be given in terms of medical equipments to ensure that we effectively respond to the pandemic. I'm therefore convinced that this donation couldn't have come a better time when we are still faced with the pandemic.
The COVID-19 pandemic has affected healthcare workers, and the Bank of Namibia says the need to protect them is urgent.
The recent data, however, indicate that COVID-19 infections among health workers may be far greater than the general population. Without the equipment needed or their proper use, they too are increasingly susceptible to infections. We need to do everything in our power to ensure adequate quantities and quality of PPEs for our health workers throughout the whole country.
Bank of Namibia has earmarked part of the donations to supply PPEs for healthcare workers. The bank has also introduced measures to mitigate effects of the pandemic on businesses and communities, such as reduction in repo rates.